Hello, everyone. Welcome to CEOs You Should Know. I'm here with Dr. Brahim Ardolic, our SVP Western Market for Northwell Staten Island University Hospital. Welcome, Dr. Ardolic and Brahim. Appreciate the opportunity to meet you this morning.
Oh, thanks for having me. It's really an honor.
So we wanted to kind of get started and talk to you a little bit about your journey and what's inspired you to pursue the career in medicine, particularly the emergency care and cancer treatment as the early part of your career.
Yeah, so for me, um, I- I- the idea of taking care of people and actually going to medical school, I don't really know the first time I thought about it. I love telling people that I'm actually not sure if I decided to be a doctor or if my mom convinced me that I decided to be a doctor. And I'm convinced that she actually pulled a Jedi mind trick on me and actually I decided I was going to go to medical school and she got what she wanted. Then going into emergency medicine for me was a natural fit. I love the idea of taking care of everyone that walked in and being responsible for every person that walked through the door, and also like the kind of mystery of it. I love the idea that you didn't know what was wrong with people when they walked through, and it was on you to help them figure it out. So for me, that was kind of a draw. And then, frankly, my path, I went to running a department. I was running a department of emergency medicine, and I thought that was my passion. I thought that would probably be the last job that I ever had. And it was really for me. And probably will be the thing that I would want them to write first on my tombstone, right? I developed a department of emergency medicine. I started a training program with some amazing people, developed a core group that took care of a population of 500,000. It was something I was very proud of. And then I, was asked if I wanted to help Northwell run a hospital, and something that I never even thought of, frankly. And that kind of got me into the next phase of my career. And I was fortunate enough to come to Northwell Staten Island right at the point where we were looking to bring the Northwell Cancer Institute to Staten Island and to build something really special that would allow us to extend our reach and to do comprehensive cancer care right in the place that I grew up. So that was a special thing for me.
So let me dig a little bit deeper there. And it was just such a pleasure to read about the advancements with the emergency department at Northwell Staten Island University Hospital, which led to your new mission and new responsibilities. But let's touch on what you kind of just started to talk about. You've made significant impact on Staten Island's healthcare landscape with Northwell Staten Island University Hospital, specifically with Florina Cancer Center. Brahim, can you give me an overview of the center, its mission for world-class cancer care and servicing the local community, and sort of Northwell's vision and success in serving local communities overall?
Yeah, so Northwell looks at cancer care a little bit differently in terms of how we want to present this to our communities, right? So the Northwell Cancer Institute isn't a place. It's an entity that will deliver the highest quality care and get you the care that you need, and do it in such a way that we could actually do it close to your own community, so that we can do it in your neighborhood. So when we had the opportunity to take what was already, a really great staff that were taking really good care of people, but we're doing it in a place that was a little antiquated and was a little colloquial, and we could actually put them into a brand new building with real state-of-the-art equipment, with real better operations, and then actually also bring in the Northwell Cancer Institute label and actually be able to put the kinds of trials that people need, right? The kinds of therapies that people need, and do it all in one place. So the hallmark of it really is you can get all of your care done in a single location, and you can do it in your own community. So if you're a Staten Islander,
you don't have to leave.
You don't have to leave. You can get your surgery there if you need one. If you need chemotherapy, you'll get it done in the same location. If you need more complex doctor visits, or you're still in the phase where you're trying to figure out what's wrong, it's also right there. If you need radiation therapy, it's right there. So not having to worry about where it is and being able to do it with a short car ride to where you're being taken care of, as opposed to having to worry about who's going to take you into wherever you're going for care and how are you going to navigate this. It's really a hallmark of where we're trying to go, and you are seeing it now develop in multiple communities that Northwell's involved in. I was just blessed to be involved in it as we were bringing it to Staten Island.
Yeah, and I want to expand more on that. And I know you're close to Northwell Cancer Institute, the hub, and taking all the different vision and secret sauce of the Northwell Health System and what you've done with Florina Cancer Center. But Brahim, tell me, you've been described as an advocate for Staten Island. And you just talked quite a bit about servicing the community there, but what makes the community so special to you personally? What in the community is the connection that influences all of your amazing work in healthcare?
So Staten Island's an amazing place. It's really the melting pot of New York a generation later, right? If you want to know who's coming to Staten Island, all you got to do is look back 20 years and see, okay, who was coming into New York City 20 years ago? And you see this flow of people towards Staten Island. And it's just this amazing place that is still a little old school, still a little suburban,
Yep.
right? And you don't feel like you're exactly in the hustle bustle of New York City. And yet at the same time, you've got this amazing collection of individuals that want to be there and will help each other. I love saying about Staten Island that when you walk around, you really don't realize that you're in a place that has 500,000 people. You feel like you run into the same people. You feel like you see the same people. I remember walking out of a shift and going into a deli to pick up some cold cuts to take home for the next day, and you're running into people that you've taken care of.
Right.
And you don't get that anonymity feel that you get in some parts of New York City, and yet you're still in what has really continued to become more and more diverse, and it's a beautiful place.
That's great. That's great. Let's talk a little bit more about how you balance responsibilities at the hospital with your passion for teaching. And we know that you have an amazing staff, and certainly what you've done in the emergency department led to your position today, which continues to teach healthcare professionals across the Northwell Staten Island University Hospital. What do you enjoy most about working with the next generation of healthcare professionals?
Yeah, for me, it's always been about the idea that if I take care of one patient, I can really help that patient. And if you think about it, over the course of a career, one emergency physician sees around 100,000 patients in the course of their career. And that's how many people
Wow.
they're really helping, right? But if I can help train 5 residents a year, and I can do that for 10 years, I can actually impact a couple of million people.
Right.
And if I can show somebody how to do something, if I can help them get a little bit better at something, I've always really believed very strongly in the compounding impact of that and how many humans' lives that you can actually affect. So for me, teaching and moving people further along their career,
Yep.
regardless of what you're doing. And I've kind of finally come to the conclusion that, you know what, you don't have to be just teaching doctors how to be better doctors. If you can teach people how to be better at running in a hospital, if you can teach people how to be better at anything they do, the number of people that you impact is exponential.
Wow. That's incredible. We're here with Dr. Brahim Ardolic, SVP, Western Market, Northwell Staten Island University Hospital. Thank you for joining us today on See You As You Should Know. I wanted to ask you a question. You've led the hospital's response to some of Staten Island's most challenging times, including crisis times like Hurricane Sandy and Irene. Managing a staff, managing the hospital, how do you stay calm under pressure? And how did that experience change or develop your leadership style, impacting so many residents on Staten Island and so many staff members during that time, those challenging times?
Gosh, you learn a lot during crisis,
Yep.
right? And I think you really see the best of people during crisis. And people really come together during that moment where we have to make sure that we can get through something together. So for me, the learning experience was how many people will honestly try to help their fellow man in this moment of, my gosh, what are we going to do? For me,
Right.
some of the most vivid moments of going through Superstorm Sandy was the guy who risked himself in his truck to get his neighbor who was having an active heart attack into the hospital,
Right.
despite the raising waters. So for me, the humanity is one of the biggest lessons, and planning. I can tell you that every year, I think we've gotten better at planning for future disasters based upon what we continue to learn. And frankly, you do get very good at all these different kinds of situations because we live in a world where things do go wrong, whether they're weather related, whether they're utility related. But I used to think, why do I keep being in these situations where I've got to go through these disasters? And I frankly think that this is something that we do have to get used to, that we're going to have these kinds of events, whether they're weather related or otherwise, and it's on all of us to better prepare to take care of our communities.
Yeah, and I think you see that in many different categories and
Yep.
verticals of leadership and hardworking frontline individuals, like all the folks at Northwell Staten Island University Hospital. I guess a follow-up question to that would be managing a hospital involves juggling. I can't even imagine how many different priorities. But that said, how do you balance the needs of your staff, the needs of the patients, and the broader community while ensuring that the top quality healthcare remains top priority?
Yeah,
Probably a lot to unpack there.
it's interesting. I've actually come to the conclusion that those things aren't that different, that they're all kind of the same thing.
Connected.
I think that happy staff that like what they're doing and that are actually believe in taking care of humans leads to happy patients and actually gets us to where we want to go there. At the end of the day, happy, content staff that you're giving a good job to need to be matched up with good processes that you believe in and then appropriate spaces they can actually work in. And you need all three. But after a long time of thinking about this, I don't really think that there's much differentiator between happy staff and happy patients. I think
Yep.
one leads to another. And if you can look at them in totality, I think the great majority of people that go into healthcare go in because they really want to help other people. And if you can put them into situations where you give them that opportunity, they will rise to the occasion. And I think that that's really one of the key goals is to keep people content, keep them happy, give them great work environments to work in, and they will do the rest, and they'll take care of the amazing patients that come in.
That's incredible. Something that you have for sure done with Northwell Staten Island University Hospital. And Brahim, we were just chatting before we went into our CEOs you should know here, but your role is being expanded with the Western Market presidency to cover additional landscape. Is that going to take away time from Northwell Staten Island University Hospital? Is it going to be able to develop you as a leader to maybe see new challenges and things that you might be able to adapt to Northwell Staten Island University Hospital?
Yeah, listen, I think that growth is good, and I think change is good for everybody.
Yep.
I can tell you that when I left emergency medicine and actually went into a hospital role, Dr. Nicole Burwald followed me, and I really think that she grew and improved on what I actually did. So as I look and pick up some of these additional responsibilities, I think that creates opportunity for people to continue to grow their careers and build stuff and also add new ideas.
Yep.
Right? And also kind of start to align and do really great things that we can do across multiple venues. So I always look at these kind of things as both an opportunity for me to actually look at how everything is done and look to see where there's opportunities and also opportunities for people to step up and actually grow their careers. I've kind of come to the conclusion that there's a set amount of time people should be in a job, and once you've been in a job for too long, it almost becomes too easy.
Yeah.
And I don't think that's healthy,
Yeah.
right? Because I think that's when you stop being creative. I think that's when you stop growing. And for me, I think that you continue to look for opportunities for people to grow because when you do, they will often surprise you with how many amazing things they do.
I love that. That's an amazing leadership response to that question. And it sounds like the Northwell Cancer Institute's mission to providing local community access to the best care continues, and that will be always top of your responsibility list for any of the new landscape that you cover. Brahim, as we wrap up here on CEOs You Should Know, what's one thing you hope people will take away about Florina Cancer Center, its work in the community, and maybe something we should know about the future Florina Cancer Center for the Staten Island community?
I think the consistent Northwell message that you can get world-class care,
Yep.
and specifically in cancer, in your own community, and you can get that done in a comprehensive fashion where you can get a world-class surgeon and you can get a full spectrum of care regardless of what you need, including access to clinical trials, and you can get that done without having to commute 2 hours in each direction is a big part of what the Northwell message is across the board. And you're going to see that in different neighborhoods, and I'm blessed to have been so involved in bringing that to Staten Island, but that's a consistent message. You can get all of this stuff done and get through this horrible diagnosis,
Yep.
right? and do it in your own neighborhood. And I think for the future, I'd give a broad message in that cancer is no longer the terminal diagnosis that we used to think of it, and that many of us still think of it that way.
Yeah.
We have done remarkable things to get cure rates up in certain diagnoses. We've also done remarkable things in some of these uncurable cancers where you can actually extend the life really significant time where you weren't able to before. So I think one of the biggest messages is we can give you all of those opportunities in your own neighborhood, and you will continue to see Northwell do that and expand to different communities as we're actually doing this. This is just the most recent one.
That's great. Brahim, tell me how the community can get involved more with Florina Cancer Center, specifically in outreach efforts, donation causes, et cetera.
Well, there's a wonderful one that's occurring right now with Elvis Duran and Alex Carr. There's an amazing opportunity during Movember now to actually buy a mustache and really show your support. All that money is going locally to the Florina Cancer Center, and it's really a wonderful opportunity to support the women and men that are actually taking care of your loved ones every single day. What I would say to people is it's incredible how many generous people I meet. It's also incredible how many people donate money to medical causes but don't actually look at where that money is actually spent.
Right.
So I would encourage everyone to ask the question, when you're donating money to a medical cause, how much of those dollars are actually spent in your own community taking care of people that you would like to take care of? Because there are women and men right now that are working really hard to take care of your children, your parents, and everyone else, and we need to support those people every single day and make sure that we can deliver the highest quality of care as we actually go through. So I want to thank Elvis and Alex for the amazing work they're actually doing, and that's the most recent example that we can give of something you can do right now.
Yeah. Brahim, regarding the Movember program with Elvis Duran and Alex Carr, and you know how endearing they are to Northwell Staten Island University Hospital, Elvis has gone on air and talked about the generous doctors and staff saving Alex's life. The Movember program and buying the mustache. To learn more about that, do you have that website?
Yeah, it's northwell.edu/Elvis.
Yep.
It's a great program. We love them for what they're actually doing and also just the way they're doing it. Just talk about caring about humans. It's really an incredible thing.
That's great. Okay, folks, we are with Dr. Brahim Ardolic, our SVP Western Market President, Northwell Staten Island University Hospital, on CEOs You Should Know. Brahim, it's been a pleasure. And I do want to just offer one more question. You know, we were talking about being a dad and being a leader. Is there anything that you want to give advice to maybe some of our young listeners out there aspiring to be doctors, aspiring to be leaders within their community? Something that maybe you've developed as your own wisdom or insight for talking to the leaders of tomorrow?
Yeah, I think what I would say to people is find your passion. Don't chase after something because you think it's what other people want you to do, or it seems like a good idea, or it seems prestigious. If you truly can see yourself taking care of people and you're willing to put the work in and you're willing to do the things that are necessary, go for it. Follow your heart, but do it in a way where you don't lose your passion and you're doing things for the right reason. And if you do, even if you don't get exactly what you thought, you will often get exactly where you need to be.
A good result, unless your mom forces you to become a doctor.
Then it worked out great. I thank her now for it all the time, but I am convinced that she convinced me.
Yeah, I think that's excellent advice. Again, coming from yourself, being a leader in the healthcare industry and an amazing family man at home. So I'd like to thank you for joining us today.
Thank you so much.